Are you experiencing chills, fatigues, fevers, headaches, and a rash? Do you find that your muscles and joints ache and you really can't figure out why? How about if you've been bitten by a tick lately or you're in an area where ticks are known to live? Lyme disease is rampant in the modern world at the moment. It used to be confined to specific regions, but in recent years, this has all changed. And so, this is the Dr. Lyme Show, and today we're going to be talking about Lyme disease and its connection to adrenal fatigue. I'm Dr. Jeremy Lamb. I'm an integrative practitioner. I also specialize in internal medicine, and I'm an expert in holistic care of chronic illnesses.
And I'm Dr. Carrie Lamb with a background in family medicine, anti-aging, and integrative medicine. And I'm very passionate about nutritional health and lifestyle medicine. So before we get started, we just want to ask you to please like and share if you enjoy, or subscribe for more videos that we put out so that we can be more visible to those who actually need it. So let's take a look at Lyme disease, what it is, what it isn't, how to help it, and how it's connected with adrenal fatigue. So Lyme disease, or chronic Lyme, has a lot of overlapping symptoms with adrenal fatigue, but let's just talk about Lyme disease in general. What is it, Dr. Jeremy?
Well, it's a tick-borne disease and has been growing in number of cases. Now, normally it's just in the northeast of America, but it's actually just been spreading worldwide. Wherever there are ticks, that you're at risk of Lyme disease. And there are very few people who are actually able to detect Lyme disease with the classic symptoms such as a bullseye, rash, fever, fatigue, etc. And by the time that people have been diagnosed with Lyme disease by their doctor, it's usually by a history taking and then by blood tests, and then they are put on antibiotics. And usually, if it's done while they're young, while you catch it on early on, then most people actually recover. But there's a small percentage of people that do not recover, and these are the people that develop chronic Lyme.
Right, chronic Lyme is a state where your body continues to have to fight these pathogens. They're in the body, they like to burrow very deep, it's very hard to get rid of. And even though their levels might be very low in your system, they can wreak havoc. So you might think that, well, if I take antibiotics, the Lyme should go away. But a lot of times, even the antibiotics might not target these pathogens fully. And therefore, if they burrow deep into your cells, and they can stay dormant for a long time, and they're at such a low level, it escapes detection. So these toxins that the Lyme pathogen secretes can attack the body and cause inflammation, cause an immune response. And the good news is that most people have a built-in mechanism to be able to deal with this stressor, and that's called your adrenals. So Dr. Jeremy, how is the stress response from the adrenals related?
Well, the adrenal glands produce the key hormone cortisol, which is your main body's anti-stress hormone. And so, athletes even use cortisol injections because it reduces inflammation, balances your immune system. And so, when the body is faced with toxins such as Lyme, it automatically puts out cortisol. You don't have to ask it to, it naturally does this. And the cortisol rises when the body is more stabilized, and then the aches and the pains go away. Then cortisol levels go down because its job has been done to reduce the inflammation. The problem is when you allow the body to keep continuing to get exposed to these toxins month after month, year after year, and failure to really nurture the adrenals. And so what happens is a soldier that keeps fighting the same battle over and over again, he gets tired without the adequate rest and without giving the adequate nutrients to the support the adrenals, then the adrenals become fatigued and a lot of convoluted symptoms come up.
Right. So adrenal fatigue symptoms can look like hypoglycemia, sleeplessness, low blood pressure, being tired, having heart palpitations on and off, even at rest, and waking up in the middle of the night, feeling weak, and hungry all the time. So any of these symptoms can kind of come and go, and they can be a reflection of adrenal weakness. So if a person has chronic Lyme or neural Lyme, where there's ramifications on or on, so if a person has chronic Lyme where they've been on antibiotics for a long time, that can also affect your gut health and therefore also your adrenal weakness. A lot of the patients that we see have been on chronic antibiotics for a long time for chronic Lyme, and ultimately we see that their GI system gets affected, and that can also lead to the adrenals becoming weaker. And so if any of these symptoms sound familiar to you, you've been on antibiotics for a long time, you're still not feeling better, with a chronic Lyme, you want to think if it's affecting your adrenals also. And so if you're struggling with this and you can't get the help you need, talk to our team, 714-709-8000. Give us a call because we're knowledgeable. We can help support you even while you're going through Lyme disease treatments. So, Dr. Jeremy, we talked about how adrenal fatigue and Lyme are connected, but what can people do about it?
The key thing to really understand if you're dealing with chronic Lyme is not about fighting Lyme anymore. It's about a way to give your body everything it needs so that the body will do the work for you. That not only includes the adrenal system, but the detox system, the neuroaffect circuit. And it's not really about a patching approach either. It's not just about taking supplementation to strengthen the adrenals. It's really about just nurturing the adrenals. It's almost cuddling your whole system and giving the adrenals the right tools. And this is a very tricky because most people don't understand these concepts. And if they do understand the importance of the adrenals, they just go out and buy herbs and glandulas, rhodiola, ashwagandha, green tea, maca. And then these just stimulate the adrenals in order to have less fatigue. And then they eventually start to feel better, but then is not really still addressing the underlying problem. And so eventually gets worse.
One thing that I do see from chronic Lyme patients is that they are generally usually very sensitive. A lot of times they try certain supplements and herbs and it has a paradoxical reaction to their body. So what does that mean, Dr. Jeremy, if someone is paradoxical and they can't tolerate some of the treatments that they are trying to undergo?
Yeah, like you said, oftentimes we do see a lot of the cases where they actually end up feeling worse, even though they've gone through the proper treatment. And so that means your underlying constitution is much weaker, whether that is the adrenals, whether that's your detoxification circuit. Ultimately, that needs more further investigation and challenges. So whether there's MTHFR that's not working, maybe the garbage disposal in the house, in the kitchen is just not working properly, and you have to make sure that that garbage disposal is working before you throw other things in, right? Or else it's going to overflow and make things worse. So ultimately is, again, if that's the issue, then maybe we focus on detoxing the body, and it has to be even in a gentler way because you can't detox too hard as your body can crash even harder.
Right. So for those very sensitive people that crash with supplements, make sure they ask their doctors what is the right things, and you start one at a time, and you don't want to just do the big guns right away. You have to really gauge where your body is. And if you are very paradoxical, even with detoxes, then maybe something like low dose immunotherapy, which is to help your body build immune tolerance to the Lyme bugs, whether it's Borrelia burgdorferi or whether it's Babesia or any other tick-borne illnesses. There are low dose immunotherapies that you can do sublingually to help your immune system build tolerance to these bugs, as you can do it homeopathically and very gently so that you can tell a difference if it makes a difference or not.
And so a strong adrenal is really important to a fruitful and fast Lyme recovery case. So that's the overarching philosophy when it comes to healing the body and the adrenals, is that you want to make sure that your underlying constitution is strong. And if it's not, then you try to strengthen it and use other modalities like Dr. Carey had mentioned to get your body back on the right track. So if you call 714-709 for 8,000 for a free initial phone call with our staff, you can get expert guidance and support on that journey. They also help ensure that you don't end up suffering from symptoms and problems and self-navigating yourself. That's the hardest part. And there is hope for you. You just have to make sure that you're under the right practitioner, following the right guidelines in that standpoint. And so to talk about supplements, we also have to talk about supplements that you have to avoid for Lyme disease, because there are a lot of supplements that are trying to help but end up actually making things worse and your vitality being robbed. And so, there's a lot of supplements out there, and you hear, okay, this supplement is good for this supplement is not good. And so there's no such thing as a good or a bad supplement. There are supplements that are just fit for the body at the right time. And ultimately, if your body doesn't like the supplements, it's going to send whispers out and let us know that. And so if you're very fragile, if you're very having paradoxical reactions, like you said, then make sure that you ultimately listen to your body and what it's telling you. If you feel worse, don't think that you should just push through, because sometimes it can make your body even further along and weaken your constitution. So ultimately, it's about really listening to your body. It's an individualized approach, that there's no one protocol for everyone.
Right. A lot of patients come to us, they say that they're tired, and so they take vitamin Bs, vitamin Cs, even glandulars and adaptogens, thinking that they want that boost in energy. However, when you are a very sensitive person and your adrenals are weak, the downside is that you can overstimulate your adrenals with some of these vitamins. Even though they're good for you, they might not be good for that time, right? So what what you said was very accurate, in that your body has different stages, different constitution, different delivery forms of supplements, and vitamins are needed to fit your stage of where you're at in recovery. And so make sure you always find someone who understands what mode you're in and what stage of your recovery you're part of. Because if you are very, very sensitive, you want to be very careful about starting any type of supplements, even at the regular dosage. Sometimes we do, wrist protocols or even sublingual protocols in order for the people who are very sensitive to get used to some of these things. So it is very personalized on the way we treat patients.
And so we've talked a lot about Lyme disease today, as well as how it correlates with the adrenals. And the key thing here is really, again, that there is no one size fit all approach. And we've seen not the side effects, but the harms that come when we just throw the kitchen sink at your body and things end up actually getting worse. So ultimately, it's about finding a practitioner that can help you with this journey, because you have to ultimately listen to your body and take the proper steps to make sure that you don't end up getting worse, as we see it too often every day. So for general information, for basic information on finding practitioners that are capable in helping you get on the right track with your adrenals and with your Lyme, you can talk to our team at 714-709-8000, and we'll be glad to help you out. We're glad that you listened today on the Dr. Lam Show, and we're here to empower you to take control of your health.